You are listening to the Health and Wellness Podcast, curated by Dr. Lori Marzell. Dr. Marzell is a primary care physician and a certified menopause practitioner that combines the wisdom of natural medicine with modern medicine to help maintain optimal health. She has a special focus in food allergies and bioidentical hormone replacement. Thank you so much for being here. Enjoy the show.
Hi, this is Dr. Marzell. Today I'd like to talk about an article that I read written by Jonathan Wright, who is a medical doctor, incredible physician, and an expert in nutritional therapy. He wrote about a study that was done I found very, very interesting, and I think you will as well. There are two types of diabetes. The second type is the one most common. When people get older, they may start becoming diabetic. But type 1 is a type that maybe most people are not that familiar with. And it usually is a type that can occur in very young people, usually due to some kind of inflammation caused by the body. In this particular newsletter, Dr. Wright reviewed an article about the research that was done in using Gaba, a brain neurotransmitter. This is produced by the beta cells of the pancreas. These are cells that also produce insulin and are attacked and killed by a person's immune system if they develop an autoimmune reaction. Actually, this just about wipes out the body's insulin. Insulin is important to transport glucose into the cells so they can be used as energy. This drives up blood sugar because it can't get into the cells, and this wreaks all kind of havoc for the body. In this particular study, mice were injected with Gaba before being exposed to chemicals that were known to kill beta cells. They found that the mice who were injected with Gaba had less destruction of the cells, the beta cells. 85% without Gaba were killed, 15% if Gaba was injected. The Gaba mice did not develop diabetes and had nearly normal insulin levels and beta cell mass. In another study, a group of mice who had developed severe diabetes type 1 were given Gaba injections and found to regain some of their beta cell mass, which improved their insulin levels and lowered their blood sugar levels. In other words, the injected Gaba helped to repair and reverse the damage the mice had experienced to their pancreatic cells. Another study, which I found equally exciting, involved one of my favorite nutrients, niacinamide. In this study, niacinamide was added to the stem cells of mice. It changed them into insulin-secreting cells, which were transplanted into the diabetic mice, used to reverse their diabetes. Stem cells normally are present in various organs, so orally supplementing with this nutrient may help stimulate the body's own stem cells. Another interesting point made in regards to the connection between autoimmune diseases such as rheumatoid arthritis, celiac disease, pernicious anemia, and diabetes type 1, and cow's milk and gluten sensitivity. One of the reports indicate that anti-gliadin antibodies produced by gluten-sensitive people directly inhibits an enzyme pathway that produces Gaba in the pancreas. A true aha moment. Research using nutrition to stimulate a person's own stem cells to reverse this highly destructive disease is very promising. Nutritional therapy is more often less toxic than many drugs, and repairing the problem with the body's own cells and stimulation of body's enzymes being used for research for cancer therapy as well. Another study, I'll go on with a few more interesting studies. Another study published in Lancet explored the possibility of preventing the development of diabetes type 1 from occurring. This form of diabetes occurs in childhood and is accepted as an autoimmune disease. The job of insulin is to send glucose from the blood into the cells for either conversion to energy or storage. Diabetes 1 occurs in childhood. It's usually detected about age 14 or so. It begins a lifetime of a person's struggle to maintain their blood sugar at safe levels, avoiding arterial plaque, kidney damage, eye or blood vessel damage that may occur. This particular study followed 12,000 children from the first year of life in 1966 to 1997. The amount of vitamin D the children received in the first year of life was noted, and the number who developed diabetes was assessed 31 years later. The results showed an 80% reduction in development of diabetes type 1 in children who received vitamin D supplementation regularly at a dose of approximately 2,000 units a day. Now, we all live, at least people in my state, in a state that does have sunshine once in a while, but not a lot. We have many months of rainy weather, and we really can't depend on getting vitamin D from our skin on exposure to sunlight. So if we're talking about studies helping prevent diabetes in children, and this is 1 or 2 year olds where they need to have about 2,000 units, really, I feel an adult, especially living in Oregon around Portland, probably needs 5,000 units a day to remain healthy. Vitamin D does so many good things. It can help prevent cancer. It helps your brain. It helps your immune system. And it is just an incredible substance. So if we're using 2,000 units in little children to prevent diabetes, maybe we should think a little bit more about probably most people could use a little extra prevention. Hope you find these vignettes from research interesting, and thanks for listening.
Thank you so much for listening. If you learned something, don't forget to share with a friend. You can visit us at www.drmarzell.com. We create content for you. If there's a subject we have not discussed or a topic you want to dive deeper into, let us know how we can empower you. Questions can be submitted on our website under the podcast page. Until next time.